Thank you for joining us once again here at Senior Mark TV. Today we're going to break into our regular series that we have been doing on Medicare Alphabet Soup because of the upcoming annual enrollment period for the prescription drug plans. And what I'm going to do today is do a walkthrough on how to shop your Medicare prescription drug plan on the Medicare.gov website. So the first thing we need to do, we need to get on the internet. Most people use Internet Explorer. If you use another program, go ahead and click to open that up. It'll probably bring you to your home page that you use most often. Then go up here in the address bar, click there, and enter www.medicare.gov. Make sure you do .gov, G-O-V. Don't do .com because it'll take you to a different website. So once you enter that, go ahead and hit the enter button. That'll take you to the Medicare homepage. When you get to that homepage, if you look down here to health and drug plans, go ahead and click on that button. And then it'll open up over here to the right, compare drug and health plans. So go ahead and click on that. That'll bring us to the Medicare Plan Finder page. Here you want to enter your zip code. I'm going to go ahead and enter Sydney's zip code since that's where our office is located. And then go below and click on Find Plans. Now this will bring up a pop-up because a lot of zip codes will span several counties. So go ahead and select the county that you're in and click on the Continue button. This will begin the first step in enter information. This first page, it's not going to be real important what we put in here. That's more important if you're shopping the Medicare Advantage plans. But since we're going to be shopping just the prescription drug plans, just go ahead and click that you currently have Original Medicare, and then go down here below and click the box for No Subsidy, and then click on the Continue to Health Plan Results button. Now this will bring us to the next page where we enter our prescriptions. So if you go into this box here, name of drug, I'm going to put in lisinopril. That's a pretty common generic medication for high blood pressure. And if you go right below, it has the two options, lisinopril, and then there's a combination drug, lisinopril HCTZ. So I'm going to select lisinopril. That's going to bring up a pop-up box where I can pick my dosage and the quantity that I take every month. So in this case, I'm going to choose lisinopril tab 20 milligrams. Click there. I do take 30 a month. Every month I take 30. And then go down here to add drug and dosage. Now if you look down a little further, you'll see that they did list down here in my drug list, we did add the lisinopril. So now I'm going to go up and I'm going to choose Nexium, N-E-X-I-U-M. You can see that that brings up two options here. I'm going to select Nexium. That's going to bring up this same pop-up box. I'm going to also I'm just going to let it default at 40 milligrams. I take 30 a month, and then I'm going to click on Add Drug and Dosage. Next drug I'm going to add is Norvasc. Click on Norvasc. That brings up the pop-up for the Norvasc. I take 10 milligrams, 30 a month. I'm going to add drug and dosage. Now, a lot of times if you select a brand name that has a lower cost generic, it's going to give you the option to choose that lower cost generic or use the brand name. So in this case, if you were using the brand name, you would click, I'm using that Norvasc. In my case, I'm going to use the lower cost generic, amlodipine. So I'm going to leave it default to the generic. I'm going to click the Continue button. So you'll notice down here that it does show the amlodipine as opposed to the Norvasc. So once you've entered all your medications, you can go down here. Before you leave this page, I want you to write down two numbers. If you look over here on the right hand side, where it says retrieve my saved drug list. If you go down here, it says drug list ID, and it gives that number, and then a password date. It gives you the date that you inputted your medications. I need you to write down both of those numbers, because if you call me and you have questions, on what plan would be best for you, I am going to need both of those numbers so that I can retrieve your drug list and take a look at what options you have. Once you have written down those numbers, go down to the bottom here where it says my drug list is complete. Click on that button. That'll take us to step 3, where we can select the pharmacy. And if you go down, based on your zip code, it's going to show you nearby pharmacies. So just select whichever pharmacy that you use. Below the pharmacy name, you'll have a link here that says Add Pharmacy. You want to click on that, and that'll put that as your selected pharmacy. In this case, it's Bunny's Pharmacy in Sydney. So I'm going to go over here. Once I've selected my pharmacy, I'm going to go to the orange button that says Continue to Plan Results. Click there. And that's going to bring us to our summary page of the plans that are best for us. So if you scroll down, the first thing you're going to see here under Refine Your Search, we only want to see prescription drug plans here. So we're going to uncheck these other 2 boxes. Those are only relevant if we're looking for Medicare Advantage plans. So we only want to select the prescription drug plans here. Then go ahead and scroll down, click on the orange button, Continue to Plan Results. It'll bring up a little processing box there for a moment while it's shopping the plans in Ohio. So now it's going to bring us to the plan result page. And what it's going to show in this initial, it's going to show your current plan. Since we were on original Medicare, it's going to show that as our current plan. That's not the important part. If you scroll down, it's going to give you your prescription drug plans. And it's going to rank them. If you look here, it says sort results by. We're ranking them based on the lowest annual drug cost. So what it's going to do is it's going to put them in order. If you look over here on the left-hand side, under estimated annual drug cost, you can see the first plan here, the AARP Medicare RX Preferred Plan. The estimated annual drug cost based on the medications I inputted is $1,056 a year. Now this annual estimated drug cost, that is a true annual cost. It's going to take into account the monthly premium that you pay for your plan, which in this case is a $29 plan. It's going to take into consideration if there's a drug deductible for the year. This plan does not have a deductible. And then it's also going to add in the co-pays that you will pay at the pharmacy when you go to get your medications. So it's adding those up and giving you a true annual cost. So on the first page, it's going to show you the top 10 plans. And you can see in this left-hand column, every time you go down to the next plan, it's a higher annual cost. So the first one is the least expensive overall. If you want to look at all the plans, there's a total, if you look up here, there's a total of 34 plans available in Ohio. If you want to see all 34 of them ranked, you can click the View 50 here button, and it'll bring up all 34 plans actually. Now, one thing that you can do, let's say you currently have, let's go down here and just say you currently have the Humana Enhanced plan. You can click this box here and go up and click the box for the AARP Medicare RX Preferred Plan. You can click and put a check mark in that box, and if you go up here to Compare Plans button and click on that, it's going to give you a side-by-side comparison of your current plan versus the plan that it's telling you is going to be the best plan for you for 2011. And you can see here the AARP Medicare plan on the left, the Humana Enhanced on the right, and it's going to give you a side-by-side. You can compare the premiums, the deductibles, and you can go below, and it's going to give you, your monthly cost. And if you print out this page, if you go down here to print my drug list, if you print it out, it'll give you a detail of your individual co-pays. It'll tell you for each medication what your copay is. This monthly cost here is just giving you a summary of the total cost per month. So we want to go ahead and just, you can go up to the browser and you can click the back arrow up here and we'll go back to the previous page. And then I can show you the plans again, and I can show you more detail. If you go up here to the bar, you can actually click on that plan it's telling you is the best one. Go ahead and click and highlight it, or not highlight it, but just click on it, and it'll bring up that individual plan and show you the details of that plan. So if you go down here, it's going to show you the full cost for the year. And then here it's going to give you the estimated monthly drug costs at the pharmacy you chose. So if you look here, the lisinopril is a $7.98 prescription. That's the full cost. It's only going to be a $7 copay with this plan during the initial coverage level. Nexium, full cost is almost $170 a month. Your copay would only be $45. The amlodipine, $11 full cost. Again, your coverage, you'd only pay a $7 copay. You'll notice here that you do not go into the donut hole, because if you were to go into the donut hole, you would see your cost toward the end of the year be much higher than the $88. To get to that donut hole, this number, the total monthly cost, full cost of the medication would have to be up to above $235 a month before you get into that coverage gap. So again, if we go up here and choose the back arrow and back up to the previous page again, it'll bring us again to the list of drug plans that are available. And if you look over to the right, in this last column it says enrollment begins November 15th, 2010. Once November 15th rolls around, there will be a button there that says enroll. When you shop these plans, if you want to go ahead and enroll yourself, that's fine. All you got to do is click on that button once it's there, and it will walk you through and ask you for the information. It's a pretty simple process. And when you enroll in this plan, it'll automatically disenroll you from your other plan effective January 1st, 2011. So that pretty much takes care of the walkthrough. If you have any problems, please let us know. Make sure you have your drug list ID and your password date, and we'd be more than happy to help you, answer any questions you have, or if you're not comfortable enrolling, that would help us out if you did. If not, we want to be here to help. So if you want us to enroll for you, just give us a call and we will go over everything with you and take care of that enrollment process. So hopefully that helps you out. If you have any questions for us, just give us a call. Thanks again, and we'll see you next time.